Attwood is an ear, nose and throat surgeon from Tygerberg Hospital and Stellenbosch University. Now, he suffers from what is called long-haul COVID or long COVID. We've spoken to him before about his condition, and he's here with us to give us an update, but he's also going to talk about virus transmission as well as protection and about some misunderstanding and denialism that is out there. Dr. Attwood, good morning to you.
Good morning, Leanne.
Good to see you. How are you feeling since we last spoke?
A lot better, thank you very much. Still having some days where I'm not as good as I would like to be, but I am much better, thank you.
I'm so glad to hear that because, you know, when we last spoke, I know you were really struggling with particularly exhaustion and that foggy brain and not being able to get through a day of work. Are you finding now that some of those symptoms that you were feeling are now subsided and you're able to be a lot more productive and feeling well?
Definitely. I can cope with a full day's work now.
Yeah. How many months has it been now since you contracted COVID?
Since June, so that's 6 months.
6 months ago. So would you say that that is on average probably, well, I suppose there's no average at the moment because it's all still new, but in terms of those that are struggling with the after effects, you know, giving it time, what time frame are we looking at?
No one really knows because, as you said, it's new. But it seems that 6 to 8 months is the limit, and after that, most people have recovered completely.
Yeah, fantastic, because it is concerning, and you know, you keep reading the accounts of people that are still struggling with just debilitating headaches, that the smell and the taste and general exhaustion, and these are things that some are complaining even over 6 months. They are still feeling these after effects of. I mean, do we know any more about this than when we spoke last time?
There's so many opinions, and I'm sure you're more aware than I am of the impact of easy access to information and misinformation. Some people are comparing it to what 15, 20 years ago was called ME, or still is called ME, but similar effects of a post-viral infection, chronic fatigue syndrome, I think is the term that is used. So there are lots of ideas and theories, but it seems to be that the after effect is that the virus is gone, your body has dealt with it, but the damage that it did is still having effects on the parts of the body which were affected. So whether it was the brain or the lungs or the liver or the kidneys or the heart or whatever. So it depends what was affected, how badly it was affected, and that's the recovery rate. And then also what you do to try to overcome that, the rehab, which is vitally important.
Yeah, that is a big thing, and I suppose, you know, this is something that we need to consider when we talk about the strain on the healthcare system already, just with having to deal with somebody that has COVID and struggling. But I can only imagine that we haven't really factored in the long haul. I mean, I was reading an account of somebody that was just going to doctor after doctor after doctor to try and find assistance because of the symptoms. And doctors keep telling her, but you are fine. You know, I can't find anything wrong with you. And yet they're feeling these symptoms. So this is just, it's not in the mind, as what I'm gathering from what you're saying.
Oh, no, definitely not. I mean, I know there are a lot of people who struggle that they can't find anyone to believe them, to be blunt. And I think more and more doctors now, or other healthcare providers, are now understanding that this is an entity which is causing a problem. I recently, as part of my rehab, I had an MRI scan of my brain, which was completely normal for my age, which is a wonderful thing to hear. But it didn't show any of the cause, because there is no obvious cause of the symptoms other than it's after the virus infection has affected the brain.
Mm-hmm. So let's take a bit of a step back and ask you, you know, we heard the President speaking on Monday night and putting the country back into a level 3 kind of lockdown. What were your views? I mean, when you heard this, was this the right thing from your perspective to do?
I have immense respect for President Ramaphosa. He has to do a very difficult job in very difficult circumstances. I was expecting it because I think the latest surge or second wave has been overwhelming. I know both private and state hospitals are being filled. Some are full, and the staff are being overwhelmed for two reasons: the numbers coming in, plus the normal load of illness for this time of the year, plus the fact that many doctors, nurses, and other healthcare workers are infected themselves and either at home isolated, quarantining, or in hospital because of the infection. So I think, and I know this is a very unpopular opinion, I think that it was necessary. I think he's done the right thing.
You're based in Cape Town, and we've been reporting this morning, particularly within the healthcare sector, we're saying that, what we're seeing is that infection makes up more than 40% of all acute general hospitalizations in the Western Cape, and the demand for oxygen, the demand for bed space, hospital spaces. I mean, I'm just talking to Western Cape now, not the rest of the country, because I know that's where you're based, and you've also worked, or you do work at Curtis Care. Talk to us about what you are seeing and what you're hearing about in terms of the hospitals.
I don't work at Curtis Care, I work at Tygerberg.
I beg your pardon, thank you, at Tygerberg.
It is a large academic hospital, and it's not just my own experience at Tygerberg, it's from colleagues at Curtis Care and at all the private hospitals and the other Somerset Hospital, all the other hospitals, Karlbremer in the Western Cape, that the numbers are overwhelming, but it's all very well to have bed space, but you have to have the staff to staff the bed space. And if you don't have the nurses who are vital in the management of this, and you don't have the doctors and the physiotherapists and the occupational therapists and everyone who's involved in this, you can't occupy the beds because they need staff to have them, the patients cared for. So it's a multifactorial problem. So space is filling up, staff availability is reducing, and we've got to balance between the patients related to COVID and the patients who have other illnesses which are as important to those patients and to the healthcare of the population.
Yeah. If we look at a lot of people out there are denialists, and they are. And, and I follow a range of people on social media and listen to a lot of opinions about COVID and about the spread of COVID and the wearing of masks, sanitizing, and all of these things. And some people actually laugh at the thought of having to wear a mask and saying that we brought this upon ourselves and saying, no, we didn't. It's going to happen anyway. Let's talk about this. I mean, are there misunderstandings about the spread of COVID? Perhaps talk to us about that.
There are many misunderstandings, and I'm sure most of us who have access to media are aware of the conspiracy theorists, and those are confusing the issue because a lot of people have credibility for all sorts of reasons because of what they do, who they are, and people listen to them, and they spread misinformation, and it does so at a very, very fast rate in this century. The problem is that the misinformation doesn't help because then people don't do what they should do. And we do know that COVID is spread by person-to-person contacts, either by droplets they've coughed or sneezed out, and you pick them up, you touch them, you get them in your nose or your mouth or your face, or by aerosols. So the patient, the infected person is breathing or shouting or talking or singing or sneezing, and you walk past that. So we do know that a barrier is going to make a difference. A mask will make a difference. The person who's infected, whether they're asymptomatic or not, will reduce the spread of the infection. The person who isn't infected will reduce the infection rate of them picking it up. So that's common sense to me. And then washing hands, because if a droplet lands on the surface and you touch that and put it onto your own face or mouth or nose, you get infected. And then the social distancing, because it's just simple physics. If you sneeze or cough or speak, it travels a certain distance before it falls to the ground. And if you're too close, you are at a higher risk of infection.
There's also the school of thought looking at this the fact that this is not a thing. And it is like a common cold, or it is just like the flu. And I mean, I know I'm being you do. If you have an opinion about this, it doesn't matter which way. It's kind of a thing where people are split right down. I don't know if it's split down the middle. There are some people that follow the regulations and follow the rules, and there are others that, it's kind of like a heads bashing against each other. Where does the confusion come in? I mean, why are we even having a conversation? Is it that there's just not enough known about COVID-19? Is it that people are just angry and frustrated? I mean, where would you, as a medical doctor, think that people are denying the existence of this and actually just disputing what major health organizations are telling us to do?
To be completely honest, I don't understand that, because there are some very educated people who have taken this on. They say it doesn't exist, or it's like a common cold. It's not. We do know that the spread is much more rapid than was expected. The spectrum of disease from it is varied. You can die from it. You can have no symptoms at the other end of the spectrum, and we don't understand why and who gets it. There's no obvious, apart from the comorbidities which we're all aware of, so people who are obese, people who have diabetes, people who have pre-existing lung and heart conditions, they are more likely to get a more severe form of the disease requiring hospitalization. And this hasn't really happened with any of the other viruses which have been around for the last few decades. So my understanding is that this particular one is worse than others. It's not a flu. It's not a common cold. It is much worse than that, with much worse potential outcomes.
Yeah, and this is something that we're seeing. But the other issue is, not that you're an economist and not that this would be your field of expertise, but I think what's happened is the reality of COVID fatigue. In the beginning, people were scared off by this. They were really, really petrified by this unknown that was coming in. And when we were told to lock down, we did. We hid away and hoped that we'd be okay. And then, of course, it was all the squandering of money, the promises that never came through, the amount of people that have lost their jobs, the amount of people that, to be honest, actually feel the grip of starvation more than they do of COVID. And these are unfortunately the realities of a country that we do live in. But it simply doesn't take away from the fact that COVID does exist and it is a problem. This new strain that we've got, what are your views? I mean, do you know much about this new strain? Because we're hearing that it's between 40 to 70% more infectious. We're seeing a higher death rate. I'm not sure if that's related, but in terms of studies, do you know much about this new strain?
I'm not a virologist, but I have read as much as I can. Yeah. And with any viral infection, new strains do mutate over time. And this new strain, there's a lot of differing opinions. Some opinions are that it is more infectious, that it causes more severe disease, but that is still not clear at the moment. Just to backtrack a moment, South Africa is in a terrible situation, but so is the rest of the world because of what's going on. So we all have suffered economic hardship, and I feel terribly sorry for the people who do, because, as you say, do you get the disease or do you starve? It's a very difficult question to answer, and especially with the new strain coming on, people are now concerned. There's so much information coming out that this is worse than all the others. So COVID fatigue, we're tired of this. We want to get on with life. Do we have to take a step back and go back to where we were? It's a difficult question to answer, which I don't think anyone honestly can do at the moment because we don't know enough about it. It's only been around for a month or so. I think the first recorded appearance of it was in September in Britain. And here, whether the massively increased numbers of it are caused by the end of the year festivities or the people who are infected passing it on in so-called super spread events because they're not wearing face masks, they're not social distancing, they're not washing their hands, is a difficult question to answer because the research isn't available yet.
Yeah, and this is the problem, is that when we do research, it's trying to find out who is actually trustworthy, and that's the problem, is that it almost feels like a lot of citizens have lost trust in leadership and authorities, and that's where I suppose that deficit comes from. But just I might as well pick your brain while I've got you here, but I suppose it's just asking opinions in terms of a vaccine. Would you go for it? Would you? There are a lot of people worried about going for a vaccine.
Absolutely.
There are
Absolutely.
more people worried about the fact we're only getting it in the second quarter now, not in the first quarter as promised. Talk to us about your views on this.
First of all, I would have the vaccine, even though I have had the infection, and my wife and I have both had it. We would have the vaccine because no one knows yet how long the immunity from having had the infection will last. So I would certainly have it. I've done some reading about the concerns people have about the rapidity of the development of the vaccine. And it's interesting that for the first time in our history, the whole world is focused on the same thing. So money has been poured into it. All the checks and balances have been met, rather than waiting for weeks or months between each review through the various bodies who are through which it needs to go. It's been fast-tracked. So it has been done correctly, it has been done properly, it has been done safely. And there are lots of conspiracies out about it taking over your DNA and becoming aware that governments can control you. That, I mean, to be blunt, that's nonsense, because it isn't how the vaccine works and isn't how it will work. With regard to us only getting it in the second quarter, the problem worldwide is that vaccines can only be produced in certain numbers, and they're producing as fast as they can. The transport is a problem because they have to be transported at low temperatures for them to remain effective. So yes, that is a problem which we have to face, that the world needs the vaccine. The world will get it, but it will take time for it to be transported around the world.
Well, Doctor, it's been such a pleasure speaking to you, but more importantly, it's good to see that you're doing well. After we last spoke, we can see you much better, and I just hope that you go from strength to strength. So your advice to people that are struggling with long haul is patience. Hopefully it will come right.
And ask for help. There are people who understand and are willing to assist with the rehabilitation, and just persist. Remember from last time, there's no stigma attached, so talk about it, ask about it, and say, please help me, and you'll find someone who will, because there are people out there, there are healthcare workers who are aware and will help. Fantastic. As I have found.
Dr. Rory Attwood is an ear, nose and throat surgeon talking to us about his COVID-19 journey from long haul. It was 6 months ago that he got it. We chatted to him earlier. He's looking and sounding so much better, but also just talking to a lot of theories around COVID, and some people denialists as they've been called, and also the realities behind that. Thanks again. Let's take a very quick break here on the program. When we return, I'll be standing by.